Hi, my name is Jennifer Bellamy, and I'll do my video assessment of the heart and neck vessels. I do have my consent form, which I will be faxing to you. I'll be sending to you in a document. First of all, we're going to do the neck vessels, the carotid pulse. I will palpate the medial sternal mastoid with gentle pressure, and I will do both sides bilaterally. So, take 2 fingers, palpate the carotid pulse, and I want to look for a nice, smooth, easy pulse with no pulsation or thrills. I want to look for a strong upward and slower downward stroke. The contour is nice and smooth, and it's 2+, and that is correct strength of the carotid pulse. Next, I will do jugular venous pressure, and that also is central venous pressure, and I'll get the person to lie at a 30-degree angle. So if you would lie at a 30-degree angle. Okay. Perfect. And I'll be using the angle of Louis, which is the sternal angle, and I'll use that as a reference point, and I will compare with the highest level of venous distension or venous pulsations, and normal is 2 cms or less. So, be using the angle of Louis. And that is about 1.5 cm, which is within the 2 cm mark for normal. I will notice any distension of the jugular veins. I will notice any palpations, any thrills, any bruits of the jugular veins. And what I could also do is shine a light over the jugular veins, if you would. Turn your head to the side. Relax. And I see it is nice and smooth, even, no bounding. Perfect. Next, I will be doing the precordium, and I will have her lay flat. So I'm going to switch the angle of the video. Now that we've changed positions, I'm going to be looking at the precordium. I'm going to look for any heaves. I'm going to make sure I shine a light over the precordium to make sure, if the patient had no shirt on, to make sure if there were any heaves or any thrills that would make a wave in the chest. Now I'm going to locate the apical impulse, and I'm going to do that. It creates the left ventricular, where the left ventricle rotates against the chest wall, and that is during systole. It's visible at the 4th to 5th intercostal space or inside the midclavicular line. So I'll palpate the precordium, and I'll use 1 finger, and I will lay it on the left side. The patient can lay on the left side if they feel better, but I'll use 1 finger, and I will locate that, and I'll ask the patient to exhale and hold it. Okay, go ahead, exhale and hold it. Okay, breathe. Breathe normally. Okay, exhale and hold it. Okay, the precordium is not active. You can breathe. Precordium is not active, and there are no thrills or heaves that I can palpate. Now I'm going to use the palmar aspects of my hand, and I'm going to palpate the apex, the left sternal border, the base, and make sure there are no heaves or thrills. Okay, so the 4 fingers. All right. Apex. Okay, that feels good. Next, I'm going to auscultate the 4 areas, the traditional valve areas that you auscultate at. And starting with the apex, I'm going to do the mitral valve, and that's the 5th intercostal around the left midclavicular. Then I'll do the tricuspid, which is the left lower sternal border. Then the pulmonic valve, which is the 2nd left intercostal space, and the aortic valve, which is the right second intercostal space. I'll do that with the diaphragm, and I'll determine the rate at this time. Breathe normally. Tricuspid. Pulmonic. And the aortic. I'm listening for rate, rhythm, any skipped beats, and everything seems fine. There's no clicks, no whooshes, no scrapes of any kind. And also the rate is 79, which 50 to 90 for adults is normal. So everything seemed good. The rhythm was regular. S1 is the beginning of systole, so that's the lub, and that's the loudest at the apex. And I'll listen with the diaphragm to the S1, and then S2 is loudest at the base, and that is the dup of the lub dup. S1. And it is louder than S2, and at the base is the dup. Okay, I'll listen to all four areas with the diaphragm. Next, I will listen with the bell to make sure there is no extra heart sounds, no clicking, no gallops, no swooshes, and no blowing, no murmurs. Breathe normally. Mitral. Tricuspid. Pulmonic. Aortic. Okay, I didn't hear any kind of abnormal heart sounds. Next and last in this position, I'm going to ask the patient to turn to her left side, and I'm going to listen with the bell at the apex to make sure there's no diastolic filling sound. So if you'll go to your left side. Okay, and I'm just going to listen at the base, at the apex with the bell. No diastolic filling sounds. Everything is good with the left lateral position. Okay. Okay, now I'm going to listen to make sure there are no high-pitched sounds that are indicating aortic or pulmonic regurgitation. So I'm going to ask her to lean slightly forward, and I'm going to ask her to exhale. And I'll listen with a diaphragm, and I'll firmly press that against the base of the right and the left side of the heart. All right, if you just lean forward slightly. Lean forward slightly with your hands down at your side. There you go. Okay, and exhale. Breathe normally. Exhale. Breathe normal. Exhale. Breathe normal. And exhale. Breathe normal. Okay? There was no pulmonic or aortic regurgitation. That concludes my heart video. Thank you.